So thank you everybody for joining us. I wanted to introduce our new associate, Dr. Desiree Villadolid. We're so pleased to introduce Dr. Villadolid to Aesthetic Specialty Center. She brings a very unique level of expertise, and I'm going to ask her about that in just a minute. But it's really been a missing link for our practice, so I'm so happy to introduce her to you.
Hi everyone, I'm Dr. Villadolid. Nice to meet you.
One of the reasons I brought Dr. Villadolid on board is she has an extremely high level of training. So most of us know about board certification, which you are board certified, I understand.
I am, yes.
Tell us a little bit about what you did in addition to regular residency training. I understand you did a fellowship.
Right. So I did my residency training in New York and in Miami, and then I did a fellowship training in cosmetic surgery. During this time in cosmetic surgery, I focused mainly on breast, on the abdomen, and facial procedures. So I have a wide array of cosmetic procedures underneath my belt. After I finished cosmetic surgery, I think I finished with about 1,000 cases.
That's tremendous.
Yes.
I was lucky enough to do a fellowship many years ago, and same type of exposure. I don't think a lot of people in the lay community realize there's such a thing as a fellowship training in cosmetic surgery, and it's a new specialty. So most of us are aware of general plastic surgery, but that really is more reconstructive, isn't it?
Right.
So the type of training you did was focused entirely on cosmetic surgery?
It is.
And 1,000 cases. That's tremendous. That's really more than the average board certified surgeon. So can you tell us how many fellowships there are? I don't think there are that many fellowship offerings in the country.
There aren't. I believe there's less than 30 right now in the country.
It's about the same with facial plastics, so that's less than one per state.
It is.
Pretty competitive to get into, I'm presuming, based off those numbers. So that says a lot about you, and I know back in the day there were hundreds, if not thousands, of people competing for one spot. So kudos to you, and I'm so glad to hear about your training and share that with our patients. So
Thanks. I'm lucky to be practicing in the field that I love.
that's a wonderful thing, isn't
Yes.
it? Okay, so let's just start with the nuts and bolts of tummy tuck, for instance. Can
Sure.
you give me an idea? Who's a good candidate in general for tummy tuck?
A good candidate in general is massive weight loss patients or patients who've had pregnancies and are finished having their children.
That's quite a bit of people.
Yes.
You've got a lot of women who've had babies. It stretches out the skin and the muscle, doesn't it?
Yeah, sometimes that skin just doesn't retract back.
Right.
So a tummy tuck is a way to remove that excess skin from the lower abdomen, and also it gives us a chance to tighten the muscles underneath our tissue.
Great.
Yes.
Seems like there's a lot of patients undergoing gastric bypass or bariatric surgery. So is this what you're talking about for the patient who's had a significant amount of weight loss that may have some flaccid skin?
Absolutely.
Yeah.
So a tummy tuck is great. For those massive weight loss patients, you know, it feels so good to remove that excess skin from a patient after they've lost so much weight.
Sure.
Yeah.
Absolutely. I'm sure it's very rewarding. Can you tell us, are there different levels of tummy tuck or different types of tummy tuck?
There's a couple different types. There's a mini tummy tuck and a full tummy tuck. A mini tummy tuck we can usually do under local anesthesia.
Great.
Yes. Whereas a full tummy tuck, we do under general anesthesia so that we're able to tighten the muscle underneath.
So you're tightening not just skin, including the whole abdomen, above and below the belly button, right, on a full tummy tuck, but you actually can tighten that muscle that got weak from too much weight or pregnancy.
Right.
Super common problem, right?
Right.
Great. So you can really give them almost like a corset type effect.
Right.
Great. So when you're doing tummy tuck, you talk a little bit about skin tightening and muscle tightening. And I understand sometimes you might even implement some liposuction.
I
Can you
do.
talk a little bit
Yes,
about that?
I usually combine my tummy tucks with liposuction because the liposuction helps me get the fat in those hard to reach areas. So I do liposuction on the upper abdomen and then as well as the waist and the back area.
Some areas are just impossible to lose for people, so that's the beauty of liposuction. You're helping people in problem areas they can't get rid of, right?
Exactly.
Very good. That's great information. Thank you.
Thank you.
How do you patients are always worried about scars, so how do you hide that scar? Where is it actually placed?
Well, nobody likes scars, so we try to hide them in the bikini line. Sometimes a patient may already have a scar in that region from a previous C-section, so we'll use that same scar to place the tummy tuck scar in, so that way we don't add any new scars.
So let's say they're just wearing undergarments or a bikini, it falls below that garment line typically? That's great. Very good. I think patients are always interested in what are they going to experience in the recovery. So first and foremost, how long do they experience pain that requires, prescription pain medicine?
I see. Yeah, so the recovery is something that we prep our patients on during their pre-op visit, so that way when they actually have the procedure, then they're prepared for the procedure. So what we usually tell our patients is for pain, usually the 5th day we like to transition them off of their narcotic medications. By the 5th day, they're able to have their pain controlled with ibuprofen or Motrin, and by about 3 weeks, they're typically back on their feet.
Great.
Yes.
That's not as bad as most people would think, especially with muscle work and a full tummy tuck. So pain meds maybe 5 days?
Pain meds for 5 days.
Okay, good.
Yes.
What about activity level? What's a patient to expect immediately after surgery, and when are they resuming moderate and then full speed ahead exercise?
Well, even the day of surgery, we encourage the patient to walk. Walking is great. It increases the blood flow. So on day 1, patients are walking.
Okay.
I want to say 3 weeks, then the patient is doing light exercises. And then at the 6-week mark, then the patient's cleared to do their core exercises.
Anything they want to do.
Anything they want to do. Yes.
That's kind of the rule, isn't it? In cosmetic surgery from head to toe is 6 weeks is graduation day, and prior to then, light activities. I'm happy to hear that they're not at bed rest though. You actually have them walking around the house a little bit day 1 even.
Oh, absolutely. Yeah. It's a same day surgery, so patients will go home the same day, and we encourage them to stay active and walk during the same day.
Great.
Yes.
When do they expect to see their final outcome? This is it, this is your best result. About what time frame does that happen?
Well, after the surgery, they have an immediate result, okay? And their appearance improves as the swelling goes down, so they'll even see a small improvement to up to 3 to 4 months.
3 to 4 months?
Yes.
And then that's about when you take your final glamour shots.
Absolutely. We
Great.
take pictures at all our post-op visits, so that way we can monitor the patient's progression. It's great to see the body transformation.
That's why we love happy medicine, right?
Yes, yes.
Well, that's really great information, and I really appreciate you joining me in this conversation to help educate some of our patients and prospective patients. So thank you very much, and come meet Dr. Villadolid. She's fantastic.
Thank you.